Welcome everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient and Family Learning Center at Mass General Hospital. Today's program is a special collaboration between the Blum Center and Dermatology Department. Before we get started, just wanted to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so that we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for the end. Only Blum Center staff and our co-host will see your questions. I'm sorry, guest speaker. Please do not share any personal medical questions or information in the chat box. If you have a personal medical question, please ask your doctor. All right, so next I would like to introduce you all to Dr. Ramone Williams. Dr. Williams is a dual fellowship trained Mohs surgeon and cosmetic dermatologic surgeon. She is double board certified in dermatology and micrographic dermatologic surgery. Her clinical interests include micrographic surgery, facial reconstruction, cosmetic excisions, laser, Botox, dermal fillers, chemical peels, and skin of color dermatology. Professionally, Dr. Williams is a member of several associations, including the American Academy of Dermatology, the American College of Mohs Surgery, the American Society of Dermatologic Surgery, and the Skin of Color Society. She joins us today to give a talk on healthy skin and cosmetics. So please join me in welcoming Dr. Williams.
Thank you for that introduction. I'm going to go ahead and share my screen. All right. So hi, everyone. Thank you again for that introduction. My name's Ramone Williams, and I'm on faculty here in the Department of Dermatology. And today I'll be talking to you about the secret to younger, healthy looking skin. So I have no conflicts of interest to disclose. In today's talk, we'll review a few things. First, we'll define the concept of healthy skin. We'll review skincare practices that maintain healthy skin, and we'll explore how cosmetic dermatology can reverse signs of aging and sustain a youthful appearance. So first, defining healthy skin. What does healthy skin really mean? So the term flawless skin is one that we hear commonly in the media. Flawless skin is one of the most universally desired features. In a global survey of over 14,000 participants, 94% desired to improve their facial skin. Skin quality has been shown to substantially improve and impact emotional health. It impacts an individual's quality of life, in addition to how the individual perceives themselves, as well as how they interact with others. So before we define healthy skin, it's important to define what it's not. Healthy skin is not perfect skin, and healthy skin is not flawless skin. There's no such thing as perfect skin. Normal skin has imperfections, and there's no such thing as flawless skin. Even the healthiest skin will have flaws, and we'll go into that in a little bit more detail. In my opinion, as a board certified dermatologist, healthy skin means that there is a strong, robust barrier function. The skin primarily serves as the barrier between the outside world and what's going on in our bodies. And I'm going to go into a little bit more detail on that. We'll go into the structure and anatomy of the skin, and hopefully, you'll understand a little bit more about what we mean by the barrier function. So here we have a photomicrograph of the skin, or this is a photo of what the skin looks like under the microscope. At the very top of the image, here is what we refer to as the basket weave stratum corneum. It looks like very thin fibers of a basket woven together, and that is the outermost barrier of the skin. Below that, we see pink cells. These cells are known as keratinocytes, and these are the building blocks of our skin. Just below that, in the light pink, is the dermis of the skin. Now, the dermis is where the collagen and elastic fibers reside, and this largely contributes to wrinkling or smooth skin. So here we have a schematic of the photomicrograph that we just showed. And at the top, again, we have the basket weave stratum corneum. That's the first barrier to any external insults to the skin. And below that, we have the layers of the epidermis. And below that, which is not shown, is the dermis, where the collagen resides. Now, the skin on this level is referred to as the brick and mortar model. So you can envision a brick wall, a sturdy brick wall, the bricks being the keratinocytes or cells that make up our skin, and the mortar in between are lipids. And lipids are small molecules of fat that are essentially holding the building blocks of our skin together. What does this mean for us? So the barrier function is twofold. One, to keep external assaults out. These include mechanical assaults, chemical assaults, and environmental assaults. We'll go through examples of what these mean in our day-to-day lives and how we can protect our skin against these assaults. Just as important is the barrier function and its ability to keep molecules that we really need in, primarily water. So the skin functions to prevent transepidermal water loss, and this in turn moisturizes our skin. So how do we know whether or not we have a good barrier function? Essentially, if you have skin conditions such as eczema, psoriasis, or if you experience symptoms such as burning, itching, irritation, these may be signs that you have an integrity issue, a loss of integrity with your barrier function. And if any of these are concerns, you should certainly see your board certified dermatologist to discuss this more. Now that we have a basic understanding of the skin, its structure, and its function, we'll review best skincare practices. The key to maintaining healthy skin is to protect it from extrinsic factors that lead to deterioration and premature aging. Now, aging and the factors that determine aging may be considered in two broad categories. First are intrinsic factors. So these are largely genetically determined. So if you look at your mother or your father or relatives, they're, how they've aged may be an indicator as to how you will age. However, there are extrinsic factors as well. And these, for the large part, are modifiable. So we'll be talking mostly today about these extrinsic factors. So here we have a schematic of a few of these factors. The two most important to our talk today are sun exposure and pollution, but other factors play a role as well: psychological stress, hormones, and smoking. So I'll say a few words about these first, as sun exposure and pollution will be the focus on the slides to come. Psychological stress does affect our skin. It activates our fight or flight response, or the hypothalamic pituitary axis. And this in turn leads to oxidative damage as well as DNA damage. Hormones are not necessarily modifiable, but it's important to know, especially for women, as you approach the age of menopause or past that age, estrogen levels decrease and will also affect the skin. Lastly, smoking. I think we're at a great place with public health spreading awareness about the negative effects of smoking. Smoking causes premature aging and greatly damages the skin. Now, a little bit more about sun exposure. So sun exposure really means exposure to a few different wavelengths of light, all of which have their own ability to cause damage to the skin. So the first is ultraviolet light, next is visible light. Infrared and heat also cause damage to the skin. So here we have a schematic at the bottom of the slide, and it shows the various wavelengths of light. Towards the left, we have ultraviolet light, in the center, visible light, and to this end of the spectrum, we have infrared. Ultraviolet light is probably most relevant to today's talk. There's UVA and UVB. UVB primarily being the cause of DNA damage and skin cancer. Visible light, we're learning more about every day. We now know that visible light from our devices, such as blue light, can actually have a detrimental effect on the skin, including dark spots and pigmentary changes. So how do we protect ourselves from the light? How do we protect ourselves from the sun? So number 1, 2, and 3 are to wear sunscreen. We have great campaigns out now that discuss the importance of wearing sunscreen. Sunscreen should be worn year round. And I have a slide dedicated to sunscreen coming up, so we'll talk a little bit more about that. But there are other steps that we can take to protect our skin from the sun. So these include wearing sun protective clothing. Sun protective clothing will be marked UPF, which means that there's a protective factor inherent to the material of that clothing that will actually add protection to the skin from the sun. Seek shade. Instead of exposing your skin and your body to direct sunlight, we recommend seeking structures that provide shade. Avoid tanning beds. Tanning beds are extremely dangerous. They've been linked to melanoma and skin cancer, and we absolutely recommend avoiding them at all costs. And lastly, for patients who have a history of blistering sunburns, for patients who have sun damage, if you're at risk of skin cancer or significant sun exposure, we always recommend seeing a board certified dermatologist for at least annual visits to have your skin checked. So now a few words about sunscreen. So physical sunscreen is like a shield on the surface of the skin, deflecting the sun's rays. Now, there are 2 large categories of sunscreen: physical, which we just talked about, and chemical. There's been a lot of press about chemical sunscreen. In general, as dermatologists, we feel that chemical sunscreens are safe. However, physical sunscreens, particularly ones that contain 2 active ingredients, either zinc oxide or titanium dioxide, are beneficial. And we do recommend sunscreens containing those 2 compounds. So before you purchase your sunscreen and when you're in the drugstore making a decision, just flip to the back of that sunscreen and read the active ingredients list. It should say either zinc oxide or titanium dioxide if you're thinking of making a purchase. Another question I get commonly as a dermatologist is what SPF should be used. So we recommend SPF 30 or higher. So 40, 50, all those are fine. SPF 15, unfortunately, just doesn't cut it. Women should be aware that oftentimes makeup that's advertised as having sunscreen will only have SPF 15, and you really need SPF 30 or higher. SPF 30 blocks 97% of the sun's UVB rays. In addition, if there's zinc oxide or titanium dioxide within the sunscreen, there's both UVA and UVB protection, which is really important. Now that we've discussed sun exposure, we'll be moving on to discuss pollution, particularly air pollution. So air pollution is an environmental factor that contributes to premature aging. A recent study found a direct link between airborne particulate matter and signs of aging in the skin. So how do we protect our skin from air pollution? So first, facial cleansing. I recommend facial cleansing twice per day, in the morning and at night, and this helps remove any particulate matter from air pollution that may have adhered to the skin throughout the day. Second are topical antioxidants. These include vitamin C, vitamin E, and ferulic acid. These can be found in serums and other topicals. While I can't endorse one particular brand, our patients do like products. For example, Cosmeceuticals makes an antioxidant blend. Revision Skincare also makes an antioxidant vitamin C cream as well. And our patients in general have found these to be well formulated and easy to use. Lastly, a healthy diet. So we think about antioxidants, one in the sense of actually applying them to the skin as topicals, and also systemically getting them into our bodies through our diet. So fruits such as blueberries are high in antioxidants. Vegetables, nuts, whole grains, and a healthy diet in general will help protect from oxidative stress, and in turn protect from air pollution. So based on what we've discussed so far, we can talk about our best skincare practices. So if we were to have a bare bones skincare routine, we should have at least 3 key steps. So first, the cleanser. We're getting rid of any particulate matter on the skin, dirt, debris, cleansing in general. Second, an antioxidant. This can be a serum or cream, but applying this topically to the skin, or at least having a healthy diet in which we're ingesting antioxidants. And lastly, sunscreen, wearing sunscreen year round, looking out for SPF 30 or higher, as well as sunscreens containing zinc and titanium dioxide. So these practices will help maintain and actually are key to promoting healthy looking skin and also to prevent signs of aging. Now, signs of aging will be the next part of our talk. We'll talk about what does aging look like? What is it that gives someone a youthful appearance? So here we have the aging face. This image is from Allergan. On the left, we have a 26-year-old daughter, and she is next to her mother, who is 64. And here we have a side-by-side of mother and daughter. And we can see with time, there have been significant visible signs of aging. So just working our way from the top of the face downwards, we can see a loss of volume and a loss of fat over the temples. The cheeks have flattened and moved downward as well. There's a prominent nasolabial fold, which is the fold that extends from the nose to the side of the lips, which are also known as smile lines. Underneath the eyes, we're seeing prominence of the fat pads or bulging of the fat pads, and also just a sunken in look in general. All of these signs contribute to aging and the appearance of an aging face. Lastly, at the very lower portion of the face, the lower third of the face, we see sagging, jowls, and excess tissue that is not present in the daughter. Now, another way to look at the face is a theory called the inverted triangle of youth. So on the left, if we look at the daughter, we can see that most of her volume is in the upper face. She has good volume in her temples, in her forehead, in her upper cheeks, and these all give a youthful appearance. Now, if we compare that to her mother, we can see that this triangle's reversed. A lot of that volume is lost, the temples are sunken in, the cheeks are sunken in, and we get this sagging along the jawline and along the jowls. And this gives an appearance of aging. So here we have a schematic from a publication by Andrew Alexis from 2019. And this shows side-by-side changes of wrinkling, particularly in that nasolabial fold region. And you can see here, we're graded on a scale from 0 to 4. 0 is the most youthful appearing subject. And 0 because there's no wrinkle, the nasolabial fold is not prominent. As we move to 1, there's mild, shallow, just able to perceive a wrinkle. 2, there's a moderately deep wrinkle. It's visible at rest and will be visible as well, smiling. So 3, we're getting to severe, deep wrinkles. So these wrinkles are present all the time, and you can see there's significant shadowing. Stage 4, there's extreme wrinkling, a very deep wrinkle as well as a redundant fold. So you can see here, this is a nice progression over time of how the face is changing and how there's volume loss and wrinkling with time. So here we have another schematic. This is a great example of the sun's effect on aging, and essentially the sun promoting aging and skin damage. So signs of sun damage can be seen as early as 4 years of age. So you can see freckling across the nose of this 4-year-old boy. So as we move forward in time, we have a 37-year-old woman, and she has sun damage that's not so visible on the left, but on the right, when we use a UV photo, we can see that there's quite a bit of freckling and sun damage. Lastly, we have a woman at 64 years of age. She's from a beach community and reports lifetime sun exposure. You can see both on the left and on the right, there's significant signs of sun damage, particularly brown sunspot or lentiginous is the medical term for these. And then on the right with the UV photo, we can see significant sun damage. The sun not only produces brown spots, but is also making the skin thicker, more leathery, and prone to wrinkling. Now, moving on to the third part of the talk, I want to talk today about how cosmetic dermatology can help reverse signs of aging and what options you have as a patient who may or may not be interested in cosmetic dermatology. So first, I want to just kind of tell a cautionary tale. Before getting any cosmetic treatment, ask questions. There are various providers that may offer cosmetic treatments. These include physicians and non-physicians. The American Academy of Dermatology recommends that you seek cosmetic treatment from a board-certified dermatologist. You can find board-certified dermatologists on the AAD's website. Board-certified dermatologists have the education, expertise, and experience to safely and effectively reduce signs of aging. No procedure is without risk. So, be sure that you're asking what that provider's qualifications are and what the risks of each individual procedure is. And based on that, you can make a decision on whether or not to pursue that procedure. At Mass General, we have the Laser and Cosmetic Center, which is within the Department of Dermatology. We have so many options, which we'll talk about a little bit more. We offer interventional options for laser and cosmetic services. We have lasers, we have injectables, we have various devices that really tailor to a broad range of needs. So what's in a cosmetic dermatologist toolkit? So here we have a pyramid of just a few really of the options that we have as cosmetic dermatologists in our toolkit. And I've arranged these in order of least invasive to most invasive. There are pros and cons to each of them. Treatment really needs to be individualized and tailored to someone's specific needs, but I'll speak generally today about various options, and what may be available to you. So at the very top of our pyramid, we have cosmeceuticals. What are cosmeceuticals? Cosmeceuticals, the terminology derives from two words, cosmetic and pharmaceutical. And this term was coined in the 1980s. The terminology combines both words, but it is controversial regarding whether or not cosmeceuticals truly have drug-like properties. In general, I tell my patients that everything is relative. Cosmeceuticals will not and will never provide you the same level of benefit and improvement that a non-surgical intervention will. And then in many scenarios, non-surgical interventions will not provide you with the same benefit as a surgical intervention, depending on the particular cosmetic concern that you have. In general, I like to recommend cosmeceuticals in combination with in-office procedures. There are some cosmeceuticals that I feel like are kind of just great to have in your routine. Some examples include Retin-A or retinol, and this is a vitamin A derivative that promotes healthy skin turnover and it helps decrease signs of aging. There are risks to these, so I recommend using these under the supervision and guidance of a board-certified dermatologist. They're not safe during pregnancy. Now, in blue here, we have all of our in-office interventions. So cosmeceuticals, they're available over the counter. Some cosmeceuticals need to be prescribed, but most are available over the counter. And as I mentioned, those may be beneficial, but they have somewhat limited efficacy. So here in blue, we have our in-office interventions, chemical peels, lasers, Botox, and fillers. And for the next few slides, we'll be talking about chemical peels. So there are three depths of chemical peels. Here again, we have a schematic of the skin. Here is a cross section. We're seeing the cross section of a hair follicle, the sebaceous gland, and then the epidermis, which we learned about earlier in the basket weave stratum corneum, the dermis, and in yellow, we have the fat. So chemical peels come in 3 strengths: superficial, medium, and deep. Superficial peels are relatively safe if they're used in a correct way, and if they're being applied by a board certified dermatologist. They're safer for all skin types, from our lighter skinned Fitzpatrick 1 patients to patients with more melanin rich skin types such as Fitzpatrick 4 and 5. Medium depth peels, if used appropriately, can be safer in skin types with a higher melanin content. But again, you really want to be going to a board certified dermatologist with experience in skin of color. And then our deep peels are really reserved for specific complaints and very specific patients who are able to tolerate these, but they really can have beautiful results. For patients who have never seen a cosmetic dermatologist or who have never had an in-office procedure, I think chemical peels are an excellent place to start. They have very little downtime. They're very affordable compared to other services that individuals may be interested in, and they really can have beautiful, beautiful, beautiful before and afters, especially if you come in for chemical peels on a regular basis. Thank you for your attention today. In summary, we talked about what healthy skin means, which is a healthy, strong barrier function of the skin. Second, we talked about how maintaining healthy skin requires daily skincare. So essentially a routine that consists of a cleanser, antioxidant, and sunscreen. And lastly, we talked about how cosmetic dermatology can reverse signs of aging and maintain a youthful appearance. Thank you, everyone.
Thank you so much, Dr. Williams, for a wonderful presentation. We are now at the end of the session. If you have any questions for Dr. Williams, feel free to enter them in the chat box. So we have some questions. How important is it to apply moisturizer every day?
Great question. So moisturizer is very important. It's one of the essential things that you should have in your skincare routine. So moisturizer is really integral to that barrier function of the skin. If you recall one of the earlier slides that we had with that nice basket weave stratum corneum, there are also other factors, natural moisturizing factors, ceramides, that naturally sit on the top of the skin. In times like these where we're constantly sanitizing, constantly washing our hands, we're actually breaking down the natural barrier function of the skin. Moisturizers, especially a moisturizer containing ceramides, is actually able to rebuild and maintain that barrier function. Some products that our patients like include CeraVe, Cetaphil, Vaseline brand products. Those are all great products and all great moisturizers that can really help maintain the integrity of the skin's barrier function. So thank you for asking that.
Thank you. How does sunscreen affect the production of vitamin D naturally?
Great question. So this is a concern that we hear often from our patients. You know, we talk a lot as dermatologists about, you know, avoiding the sun and safe sun exposure. And, you know, part of that is a question of, am I getting enough vitamin D? So there are 2 pathways by which vitamin D can be produced. One pathway does depend on having UV conversion of vitamin D into its active form. In general, even if you're being exposed to the sun, but you're doing it in a safe way, there is enough UV exposure to still maintain a healthy vitamin D level. It's important to note that sunscreen, no matter how high the SPF, will never give you 100% protection from the sun. So even if you're getting your sun exposure in a safe way, there still is sun exposure. Also, sunscreen is tested using a very high volume of sunscreen that most people are not applying. It's actually a very thick layer that the sunscreen has been tested to produce this SPF factor. Also, there are requirements to reapply sunscreen every 30 minutes. So you can safely assume that you are not protecting yourself enough from the sun. That being said, typically there is enough just natural sun exposure if you are practicing sun safety to produce healthy vitamin D levels. Also, you can supplement vitamin D from your diet as well.
Thank you. So we have another question about sun exposure. Are all freckles a sign of sun exposure?
That's a great question, and I'm really glad you brought that up. So one of the reasons why the American Academy of Dermatology recommends that you see a board-certified dermatologist for cosmetic treatment is that you really need a dermatologist expertise for the diagnostic part of things. Many brown spots look the same. We hear about scary stories all the time and have patients who come into our office all the time where they've actually had skin cancers treated in a cosmetic way because they were not being treated by a dermatologist or by someone with that medical expertise. So all freckles are not the same. All brown spots are not the same. Most freckles are from sun exposure, but the question is it really a freckle? So it does get complicated. Part of the initial evaluation for patients when you come in for a cosmetic consultation with us at Mass General is that we evaluate the lesions. We give you our clinical opinion on what we think the diagnosis is, and if it's a safe diagnosis to be treated cosmetically. We only treat benign lesions in a cosmetic way. If we are concerned that the lesion could be something else, we may recommend a biopsy or another medical intervention. So that's a great question and an important question for safety. So thank you for asking that.
Thank you. We have an individual who's commenting that they have a bump on one of their cheeks. Can that be treated or should it be left alone?
So great question. It depends on what it is. So usually we're treating flat lesions in cosmetic dermatology. We do treat raised lesions as well, but sometimes just the lesion being raised in itself can raise a red flag for us. So if it's a bump, essentially our rule of thumb in dermatology is if it's new, if it's changing, if it's raised, you really should see a dermatologist to have the area evaluated. Just because it's raised does not mean that it's malignant, but it probably should be evaluated by a dermatologist.
Thank you. Can you comment on easy bruising and easy tearing of the skin on hands and lower arms?
Yeah, great question. So bruising is multifactorial. Bruising has to do with several things. One, patients with thin skin, and skin can actually become thinner from the sun. We find that a lot of our patients, our older patients, have thin skin, especially on the arms that have gotten a lot of sun throughout life. Another thing that bruising depends on is your blood's ability to clot. If there is an issue with clotting or if someone is prone to bleeding, there will be more bruising. So patients may be on medications that thin the skin. For example, prednisone, steroids, they thin the skin. Patients on aspirin and blood thinners will bruise more easily. Bruising oftentimes may result from cosmetic procedures. Botox, filler, other procedures, laser procedures may lead to bruising. And we actually recommend pineapple for our patients. Pineapple contains a compound called bromelain. It's available topically. It also is just as effective if you drink pineapple juice or eat pineapple, and that can actually help prevent signs of bruising. Now, if you're bruising and you feel like it's out of your normal range, or if it's something that you're uncomfortable with, you should speak with your primary care provider or your dermatologist about it.
Thank you. Is there such a thing as laser for the arms to eliminate white spots?
So laser can be performed off the face. Oftentimes when we're talking about laser on the face, but laser can be performed on many parts of the body. White spots are in general, challenging to treat. There are lasers that treat light spots. There are lasers in particular that treat a disorder called vitiligo, where there's whitening of the skin. More commonly than not, lasers essentially are honing in on a color differential. So it's actually easier oftentimes for laser to target a prominent color on a lighter background. So for example, a dark spot on a light background, because the laser is targeting that differential in color, or the laser may be targeting a dark hair on a light background. So laser for light spots is not as common as laser for dark spots, but there are lasers for issues of the skin such as vitiligo.
Thank you. We have an individual who's commenting that they had laser treatment on the cheek for a brown spot by a board certified dermatologist, and it actually got bigger. Is this common?
In my experience, it would be uncommon. And just in general, I recommend that patients advocate for themselves. If you're undergoing a laser procedure, even though it may be a minor procedure or an elective procedure, it's still a procedure that you're undergoing. And it's really important for you to build that relationship with your provider. I tell all my patients, if there are any questions that you have, any concerns that you have, reach out to your provider. If there's any deviation from what you were counseled to be expecting as an outcome, you should just ask. It's your right as a patient to ask. In my experience, it sounds like that's not something that I would expect. So I'd recommend talking to your physician about that.
Thank you. What medications are available for rosacea?
Great question. So rosacea is a very common skin disorder. For those who don't know, rosacea is characterized by redness of the face, typically redness of the cheeks. There are various stages and types of rosacea. So rosacea can initially start out with just flat redness of the face, patchy redness that can progress to prominent blood vessels. It can progress to a condition that actually looks like acne called papulopustular rosacea. And you can even get sebaceous changes of the nose where you can get enlargement of the nose from rosacea. So treating rosacea is challenging because it's a chronic condition. So I think it's important to really understand what's going on with your skin. Very few things in medicine can be cured, and that's just as true in dermatology. There's no cure for rosacea, but we have great treatments. There are topical antibiotics that are available for rosacea. There are oral antibiotics as well. Laser is an option for rosacea, which I mentioned earlier. Pulse dye laser or V-beam is an excellent option for rosacea treatment. And then we have some newer options on the market as well. So Solantra is actually a topical that targets organisms on the skin that lead to rosacea. There are also topicals that constrict the blood vessels that may be an option depending on your type of rosacea. I would say rosacea is one of those conditions where in the last 5 years, we've actually had new topicals on the market. So I would talk to your board certified dermatologist about what's new and available because there are options out there for rosacea.
Thank you. What treatments are available for lines or in wrinkles around the mouth?
Great question. So this is a great point to kind of talk about static and dynamic wrinkles. So if we think about the face, there are areas of the face that are more mobile than others. For example, right around the mouth, we're often smiling, talking, chewing. So this is an area, one, where we commonly see wrinkles, and two, where we think a little bit differently about how we treat wrinkles because there's an area of constant motion. So there are dynamic wrinkles and static wrinkles. For the static wrinkles around the mouth, those are quite amenable to treatment. Filler is a great option for smile lines around the mouth and also for the lower face as well. We are able to smooth wrinkles on certain parts of the face. For example, the glabella, our frown lines, the forehead. However, those areas are much less mobile on a day-to-day. We would not want to paralyze the muscle or smooth the muscles around the mouth because we need our mouth functionally. However, you can get really nice, very impressive improvement with fillers.
Thank you. So we have a question about deep lines in the upper lip. Could that be hereditary?
Great question. So, we talked a little bit earlier. So there is a portion of aging that is genetic. So we can all do the best that we can do, but there just is something in everyone's DNA that's going to predispose you to aging. Also, your melanin content also affects the way you age as well. Because why? Because melanin is protective against the sun. Now, lines on the upper lip are related to a couple things. One, genetics, which we already talked about. Two, smoking. People who have a history of smoking tend to have vertical lines around the mouth. Third, sometimes it's just age and sun damage. It is possible to do Botox in that area to smooth some of those lines. Filler is also an option, and laser is an option as well. So there are many options around the lips.
Thank you. We have someone who's interested in knowing more about dermaplaning offered as part of a facial at a spa compared to non-invasive procedures.
Yeah, so great question. So dermaplaning is gaining popularity. It is offered at many spas. I would say a couple of things to ask yourself. One, in general, as a dermatologist, caution patients when they seek care at spas. Every spa is not the same. And I'm not saying that all spas are bad, but you as a consumer have to do your research to make sure you are comfortable with the standards and the qualifications of the providers there and of the facility in general. Dermaplaning can have a modest benefit, but I would say, again, think of the pyramid that I presented earlier in my talk. You're going to have some interventions that give you a brief and limited benefit, and then they're going to be the in-office procedures that are going to give you a little bit more bang for your buck. They're going to have maybe more durable effects, more noticeable effects, and lastly, our surgical intervention. So again, I would ask before doing dermaplaning, the qualifications of the person. Even a procedure that minor can have side effects. So those are all things to think about.
Thank you. What does hydrated skin look and feel like?
Great question. I guess I can start with a feel. So some of the symptoms that I talked about earlier can point to an issue with barrier function. So burning, itching, stinging of the skin, local irritation. In general, that's your skin telling you that there's an issue with the barrier function. Maybe your skin is dry, maybe there's a rash or inflammation in the skin. So typically, if your skin is having any of these symptoms, you may not have enough moisture in the skin. Another test that you can do to see if your skin is hydrated, one is to look at the skin in general. Hydrated skin is going to have a little bit more of a dewy look. It's going to have a little bit more of a glow. If you have darker skin, then dry skin may have that white ashy appearance. Also, just pulling on the skin or determining the turgor of the skin, making sure that there's nice elasticity, that your skin isn't just staying right where you put it, that it's nice and elastic. Those are all signs that your skin is moisturized. But again, you're going to go not just by look, but also by feel. Does your skin feel dry and irritated? That's a sign that you really need to increase your moisture.
Thank you. We have time for one more question. Earlier in your presentation, you gave some examples of what moisturizers your patients like to use. Want to see if you can summarize that again, because you mentioned CeraVe's. What are some other ones?
Yeah, great question. So moisturizers are important all year round, especially in the winter. Patients come to me asking about moisturizers. There are different things to think about in a moisturizer. First, the vehicle. So in general, if you have dry, sensitive skin, you actually want a moisturizer in a tub. These are going to be creams or ointments. If your skin's normal to oily, then you may want a lotion, and lotions are in pump bottles. So lotions in general have a little bit more of a liquid component. And creams and ointments are thicker and they do a better job at moisturizing and hydrating. Some patients may not like that feel of having something thick on the surface of the skin and may like a thinner lotion. In general, things to think about: if you have sensitive skin, then you want to look for fragrance-free, color-free, and those are the moisturizers that I recommend. So brands that my patients like include CeraVe, Cetaphil, Aveeno, and Vaseline brands. Those are all excellent brands, and they have different products within their lines that you can choose to tailor to what you're looking for in a moisturizer.
Thank you, Dr. Williams. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
I just wanted to say thank you so much for having me. I hope that everyone had the opportunity to have their questions answered and got some take-home points. But essentially, you know, just going back to evidence-based medicine, what makes skin healthy goes back to the molecular structure of the skin, which we talked about. And healthy skin is strong barrier function, and healthy skin is not flawless skin. So thank you for having me.
Thank you so much, Dr. Williams. And thank you so much, everyone, for joining us today. Sorry, a little tongue-tied here. As I had mentioned, today's session is being recorded. So if you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a good day.
All right. Bye.